Hi, Minister Dix. I'm calling from Smithers, which is seeing by far our highest COVID numbers since the pandemic started. I'm just wondering if you could comment on how medical services are holding up across the north, given the high COVID numbers.
I would say, these numbers are very challenging. We've seen days where there are more than 100 cases. We have a relatively high level of test positivity. We're engaging, and we still have more work to go on immunization in the north than anywhere else, and significant work with respect to contact tracing and supporting people who do get sick. And we have, given our capacity in the north, a significant number of people in acute care and critical care. So this is a challenge, and we're providing, both through the BC Centre for Disease Control and other means, other supports to Northern Health, because this is a time where in Northern Health and in Interior Health in particular, we've seen the most pressure from COVID-19 of any health authority at the moment, at the present time. We know at different points during the pandemic it was much more, the higher levels were seen in Metro Vancouver, but right now that's in the north. So we're asking our health teams in the north to do a lot. We're currently at 74% first dose immunization across the north, but there are significant variations as between communities. We're seeing obviously the significant number of cases and test positivity in the Northern Health region, and so we're continuing to work on both those things.
And did you have a follow-up?
Yeah, I'm just curious to know if Northern Health Authority could be seeing tighter restrictions if this continues.
Well, as you know, Dr. Henry announced some of that last week, so we've put those restrictions in place in support of immunization efforts. And of course, yesterday, the BC vaccine card came into place, a vaccine card which will allow people to gather safely with other vaccinated people in key optional services, but important services across the north and across BC. So yesterday, coming into place, the BC vaccine card. Last week, some specific measures with respect to gatherings, because it's in such gatherings that we see levels of transmission. And of course, you know that there's a mask mandate everywhere in BC in indoor public spaces. So all of these things, the actions taken specifically for the north last week, which mirror the actions that have been taken in Interior Health, the BC vaccine card, the exceptional work that's being done by our immunizers across the north who are continuing to work and go back and work again, all of the work in contact tracing in the north. These are significant measures, and of course we're going to continue to support northern communities. Today is an example of that, although today is a vision that's beyond the immediate in terms of COVID-19 and supporting healthcare workers in the north.